241,000 newborns who did not survive their first month of life in Nigeria in 2025. 1 every 2 minutes, most of them preventable.
The idea for CeNHRI is actually a long time in the making. Early on in my career, I had the opportunity to be involved in policy making, health policy. That opened my mind to see how much being a doctor is more akin to saving one life at a time by the bedside as a clinician, but the same wealth of experience that one had garnered over the years could also be applied to newborn health. And newborn health is the most urgent thing in pediatric practice in Nigeria now, because it accounts for 41 out of 1,000 births, and that's alarming, that's disheartening. So the idea that one could bring health policy into newborn health, shaping the practice, shaping the research, shaping how we are projected to the outside world. Those were the places where these ideas first crystallized.
The Center for Newborn Health, Research and Innovation is Nigeria's first dedicated national institution for newborn health, research and innovation. It was created to help close this gap, and at launch stands as the first institution of its kind in Africa.
The most common causes of neonatal deaths are prematurity and low birth weight, birth asphyxia, neonatal infections generally. The congenital anomalies now is becoming common and is also a main cause of neonatal mortality. And then some cases of complicated neonatal jaundice. For asphyxia, as one of the causes of mortality that I talked about, they do therapeutic hypothermia in the developed countries. But I'll say that most developing countries have not been able to actually adopt that, because we don't have the facilities to actually cool these babies to those low levels. And when you are going to do that, sometimes you need to ventilate the baby. And most facilities actually do not have ventilators, so making it a bit difficult for us to apply some of those things. So that's why I say sometimes the resources are not there, and also sometimes the skills.
Through a dedicated newborn simulation center, CeNHRI trains healthcare workers, builds local capacity, and ensures that the skills needed to save newborns exist where they are needed most.
The foundation has 3 aspirations that is established, is trying to achieve in the next 20 years. The first one is that no mom, baby, or child dies of a preventable cause. And if you think about the birth cohort of Nigeria, there's about 7.6 million babies that are born every year. What that translates to is about 300,000 babies will continue to die every day in Nigeria, and that is unacceptable for us, and it goes against the priority that we have.
Progress in newborn mortality has stalled over the past decade, and behind these numbers is the reality of the families that are losing their babies, mothers that are walking home from health facilities without the reasons for which they walked into them. Globally, we all know what the causes of mortality are, and the Gates Foundation is committed to discovering the innovations that will drive the reduction in these mortality rates.
One of the primary responsibilities of any government is to secure lives and ensure that the population is healthy and productive. This fundamental mantra is what His Excellency Governor Biodun Banji lives by, recognizing the very clear nexus between health and human capital development. And so anything that has to do with healthcare, people's lives, the governor is extremely interested in that. So when the opportunity came up that the center will be established, we were very aggressive in engaging the relevant partners to bring it to Ekiti State. And it was on that basis that today we're excited to be here to commission this center.